Carrie, first, thanks to you and Didi Hirsch, long time commitment to these issues. I am thrilled to be able to say that I've been a partner, a fan of Didi Hirsch for a long time. And to everyone who's there, thank you so much for showing that if we really apply ourselves, we can make a difference. I don't know, and there have been a lot of things that we'll look back at 2022 for, but I don't know if there will be one that's more important, even though it's hidden among all the news in the frenzy and in the din of all the noise out there. But I don't know if there's anything more important that we did as a people, and certainly as folks working in public service, than stand up and stand up right 988. And so to each and every one of you, because I know that's the only way it could have happened, thank you for giving people a chance to know that if they did reach out in their moment of need, there would be someone there. I know most of us probably can speak personally about how 988 can be a lifeline and how it could have been a lifeline to those we love. And so this is one of those things that's not just for the nose counters, and it's not just for history and data. This is real. And so as I try to tell folks, 988 is far more than a number. It's a message that we hear you and we will be there for you. And every time I say that we hear you and we will be there for you, the we really means you. Because when I take the liberty of saying we, I'm not the one that takes those calls. I'm not the one that keeps someone from going off the ledge. I'm not the one that helps that person get the follow-up care that he or she needs. It's you. So thank you for letting me say we when I mean you. And you know how much we still have to do, because it's our goal, your goal, my goal, should be our country's goal. I certainly know it's the president's goal to make sure that we look at mental health, behavioral health as part of all health. It's integrated within the definition of health. So it's not just going in for a checkup on your blood pressure or on your weight, or to mend that broken bone, or give you the medicine you need for the flu. Is to find out if your mind and your spirit are well also. And we're doing that at the very beginning, not because you saw a specialist, a psychiatrist or a psychologist, but because at the primary level of care, when you first walk through the door, your family care doctor, your primary care physician is trained or has colleagues who will be there to address your needs when you first enter the door for that preventative primary care visit. That's the goal. And so we can extend it. So it's not just crisis care where you refer someone that's called 988, but it's from the very beginning. And so what we've launched is something very important that goes far beyond that contact. It is making sure that we recognize people's need to be well in so many different ways: body, mind, and soul. And so to what you've done, I like it when I can say I've done well, because I guarantee you folks like to find places they can poke me and say I didn't do so well. This is one where we can say we did fairly well. 988, and you probably know these numbers, and if you don't, let me tell them to you. A year ago, August of a year ago, about 140,000 people took advantage of the Lifeline numbers, because there were many 10-digit numbers throughout the country that people could use to call, hit or miss whether they got through and got real good help or not. But about 140,000 people reached out using those Lifeline phone numbers, 10-digit numbers. 11 months later, July of 2022, as you know, we launched 988. And a month later, after we'd collected some statistics and data on how many folks had approached us, some 215,000 Americans had reached out, a 45% increase from the August before. I think it's remarkable. I think it's great. I don't think it's a surprise that Americans are hurting and they wanted a place to reach out. I hope that with 988, like 911 for emergencies, we've made it clear someone will be there if you reach out and make the right move. And so I just got to tell you that this is one of the top things that I always pointed out about the achievements at the Department of Health and Human Services, and you all are making it possible. Please don't stop. Please recruit more. Please bring young folks to do this because we know how much young people are hurting. That's why our text and chat feature is getting astronomical use. Make a difference. Make us proud and let everyone realize why it is that 2022 will go into our history books for more than just war and pandemic. It'll go in our history books because we turned the page and realized that we can help Americans who are hurting and help them now. Very simple. 3 words, 988. Thank you all very much. Sherry, I'll let you all get to your business because it's important business and I don't want to intrude. I'm going to continue to take credit for so much of what you do. Don't stop. Thank you all very much.